Let's take a look at dental injuries. Now, if a permanent tooth is knocked out, it can often be saved if prompt action is taken. It must be handled with care and replaced within 30 minutes. Now, if a baby tooth has been dislodged, it isn't able to be put back in, but it was never meant to be in there forever anyway, so it's not a big deal if it does come out. If you're treating a dental injury, you need to be careful to handle the tooth by the crown only. That way you won't disrupt the root. Rinse the tooth in either saline or milk, but don't give it a scrub, just a gentle rinse. If it's possible, place the tooth back into the socket and have the casualty bite down on a piece of gauze to keep it in its place. If placing the tooth in the socket is not possible, transport the tooth in milk to help preserve it. If the tooth is broken, collect all the parts of the tooth. Place a cold compress on the face of the side of the injury. There's likely to be bruising and swelling as a result of the injury. Transport the casualty to the dentist urgently. Drowning. The 2021 National Drowning Report released showed that 294 people lost their life to drowning in Australia from the 1st of July 2020 to the 30th of June 2021. 80% of all drowning deaths were males, and the majority of those deaths were people between 25 and 34 years. Now, always we're going to prevent drowning where we can. Make sure people are being safe around the water, recognizing distress. If you notice that somebody is in distress, make sure that you call for help. Provide a flotation device. This is going to allow the person in distress to keep their head up and above water. Remove from water only if it's safe to do so, making sure that you're not jumping in after them. Provide care as needed, and this may include medical attention. So it's so important that you don't put yourself at risk by attempting to rescue your casualty from the water, particularly if it's outside of your swimming ability. It's better to reach and throw a flotation device. Avoid entering the water if at all possible. Remove the casualty from the water immediately once it's safe. Place the casualty in the lateral position or the recovery position while assessing their airway and breathing. Expect that the casualty is likely to regurgitate water. Commence CPR if required. Ensure the casualty is away from the water before using an AED. It's okay if their clothes are wet or their hair is wet. Making sure that it's dry between the pad and their skin is what you need to be aware of. Don't apply pressure to a distended abdomen. Sometimes the abdomen becomes swollen because of the amount of fluid that they've swallowed, but it's important that you don't put pressure on it or try and squeeze it out. If the casualty is unconscious, you need to suspect a spinal injury and follow the spinal injury treatment covered in the spinal injury topic. And call 000 for an ambulance, even if it seems the casualty has recovered. When you're caring for a casualty who has been pulled from the water, you should expect that the casualty is likely to be suffering hypothermia, have a spinal injury, and may vomit.